Hello everyone, I hope I'm audible and visible. Please give me a quick thumbs up if my audio video is all fine. All my dear students, please give me a quick thumbs up if my audio video is fine, and let me check if you can hear me properly or not. So this is the image based session in dermatology, the series. Today is the second session. I am Dr. Chesta Agarwal, your NEET PG educator on Unacademy. Unacademy is the best online platform for the preparation of pre-PG entrance examination. You have two type of classes on Unacademy. One is free classes, which are called as special class. They give you a interactive live class interface where you can answer the questions on poll. You can raise a hand and ask your doubt immediately to the educator because he is live. You can also get the notifications of the class. You'll get the lecture notes. So very similar to the paid classes. So these are the special class. Now if you like these special class, I do take one special class every day at 11 a.m. and I request all of you to please put this code and get yourself enrolled into these free classes. If you like them more, you can go for a paid classes, which is of two type. Plus, which give you an access to Unacademy live classes from the top educators. You have an access to 25,000 plus questions with printed notes of more than 12 months. We have an iconic subscription which give you an access to both Unacademy and Prep Ladder, which is another important online platform. And in addition, in iconic subscription, you get personal guidance, test analysis, expert guidelines, study materials, and study planners. Now we have a very updated and highly effective question bank available for you. So please get yourself enrolled. The batches which have started recently are the FMG batch, the next batch, the NEET PG'21 emergency room, and a last 3 year PYQ batch for NEET PG. Now this is a batch, or this is a test which will be conducted tomorrow at 9 p.m. and it is a NEET PG mock test. I request or I recommend all of you to please be live on 4th September 9 a.m. For this mock test, and you can assess you'll get an idea of your NEET PG exams, the rank and all. So please be live for this NEET PG'21 final bout. For the longer subscription, you can take Unacademy 12 month, which is the 2 month is free. You can even go for a 24 month subscription where the 4 month is free. For both these, you need to use a code, and the code is Chesta10. You have to use my name and 10 in front of it. Please do subscribe to Unacademy for 4 years, where the plus is 60,000 and iconic is 75,000. And this is the price list. Longer the subscription, better will be the interface. Longer the subscription, better will be the interface. Please use the referral code Chesta10. Please use the referral code Chesta10. You also have a bug bounty program. Like if you have any inappropriate content, you can report it and claim your prize. Just report it and claim your prize. Coming to the first question. So let me just give you, this is not the first question. I'm very sorry for this. So let's start the discussion with the first question, which is here. Starting with the first question. I'm very sorry, this is the first question. Let's start with this one. We'll come back to that question after some time. A 40-year-old patient presented to you with single anesthetic patch on the forehand. How will you treat this patient? MDT MB 6 month, MDT MB 12 month, MDT PB 6 month, or MDT PB 12 month? So can you tell me what should be the answer here? There's a single patch, that is a clue. There's a single patch, that is a clue. And if you remember, the leprosy patients are divided in two groups for treating them. One is paucibacillary and one is multibacillary. Okay, what is that paucibacillary group? Paucibacillary tells you that those patients who are given the or those who have the lesions of less than 1 to 5, those who have the lesions of less than 1 to 5 in number, and either there is presence of a single nerve or no nerve involved. That is the paucibacillary. For multibacillary, you should have more than 5 skin lesions and more than equals to 2 nerve involvement. So if you have a single patch, obviously you are dealing with a case of the possibacillary. But initially there was different kit for both multi and possibacillary. We have a red color kit for multibacillary and we have the green color kit for the possibacillary. But please do remember, all of you, nowadays we are not using any possibacillary kit. We are giving the MDT-MB kit for 6 months in possibacillary and for 12 months in multibacillary, and that is why for this particular question the answer becomes MDT-MB of 6 months. Okay, understood all of you? Previously we used to give 2 drugs for possi and 3 drugs for MB, but that is not done nowadays. According to WHO, you have uniform MDT where you give 3 drugs for both of them. The only difference is in the duration. Coming to the next question. A boy from Kashmir presented to us with the following scalp lesion. What is the diagnosis? A boy from Kashmir is presented to us with the following scalp lesion. What is the diagnosis? On doing the Woods lamp, it shows dull blue fluorescence. What could be your diagnosis? Seborrheic dermatitis, FAVAS, moth-eaten alopecia, or dissecting folliculitis of scalp? Anyone can answer this one? The boy from Kashmir presented with the following scalp lesion. When we did a Woods lamp, it shows dull brown fluorescence. Fine, amazing. So a boy from Kashmir presented to us with the following scalp lesion. The answer here is FAVAS. Now what is FAVAS? It is a form of the inflammatory tinea capitis which presents with a yellow colored crust. And I hope you can see the yellow colored crust on this patient's scalp, which is associated with scarring type of alopecia. So all these together give you an idea that you are dealing with the patients of FAVAS. Now why it is not seborrheic dermatitis? Because in seborrheic dermatitis you can see alopecia, but that will be non-scarring. Here you can see that there are complete loss of hair and you can see the scar tissue. It means you are dealing with inflammation which occurs secondary to the FAVAS. Clear, Dr. Naga? Please give me a thumbs up if you understood this question. Moving to the next one. Now in this question you have to tell me that in this particular infection, which is the most frequently affected dermatome? In this infection, which dermatome is most affected? In general, we are talking about, not depending upon this image. Can you tell me the answer now? In the infection, which dermatome is affected the most? Thoracic, lumbar, cervical, or sacral? Which dermatome is affected the most? Thoracic, lumbar, cervical, and sacral. Thoracic, lumbar, cervical, and sacral. Amazing. So this is a case of herpes zoster. And in herpes zoster, please remember, thoracic is affected first, followed by cervical, followed by lumbar, followed by sacral. So that should be the sequence. Thoracic, cervical, lumbar, sacral. Coming to the next question. Organism responsible for this condition: Coxsackie A16, human herpes virus 2, molluscum contagiosum, or virus. What is the diagnosis? If you want, I can just zoom this image for you so that you can have a better vision. And let me tell you that these are the vesicles, grouped vesicles which are present on the penile shaft. So grouped vesicle present in the penile shaft, what could be your diagnosis? Anyone can tell me the answer for this? This is I think it's a very easy question now. Very nice. Please remember, they are vesicles. And if I'm telling you vesicles, it cannot be molluscum contagiosum virus, which is a papule. Okay, now? But this is a vesicle. And this is a case of herpes genitalis. A case of herpes genitalis. Okay? The grouped vesicles are an example of herpes genitalis. Moving to the next question. Anyone can tell me the answer here? Moving to the next question. Can you tell me what is the answer here? A 35-year-old patient presented to you with pain over extremities on exposure to cold. On examination, the following facial features are present. What is your diagnosis? Systemic sclerosis, morphia, dermatomyositis, and systemic lupus erythematosus. Please tell me the correct answer for this question. Very nice, very interesting, all of you. Anyone? Yes. Now, if you look at the faces in this particular patient, can you see a classical type here, which is known as purse string mouth? Known as purse string mouth. A very, very classical feature known as purse string mouth. Now, what happened in this particular patient? Because of thickening of the skin, you classically see that the patient is not able to close the mouth completely or open it completely. It will keep on, it will keep on have a little bit of opening left. Along with the features of Raynaud's, all together give you an idea that you are dealing with a case of systemic sclerosis. All together give you an idea that you are dealing with a case of systemic sclerosis. Clear, all of you? Please give me a quick thumbs up if you understood. So 35-year-old patients present with the pain on the extremities on exposure to cold. The correct answer becomes systemic sclerosis. The correct answer becomes systemic sclerosis. The patient is referred to us by psychiatry department with the following skin lesion. Can you tell me what is the diagnosis? The patient was a referred case from the psychiatry department. Referred case from a psychiatry department. What is chronic actinic dermatitis? Karthik, chronic actinic dermatosis is nothing but another name for chronic photodermatitis. Okay, so one thing you have to note here is, why did they give you a history of psychiatry department? Like if it is a photodermatitis patient, will it be referred to you by psychiatry department? So there is some significance of psychiatry department, and very nice, Shubhangi. The correct answer is dermatitis neglectum. Now sometimes what happens, psychiatry patients do not take a proper local hygiene. They will not bath for say like weeks, days, or even month. They will not take bath. Whenever they do so, what happens? There is accumulation of a lot of skin. So whenever they do take a lot of, or they do not clean the body properly, the exfoliation of skin get hampered, and all the dust, the pollutant and the superficial skin, they will start accumulating on them, giving rise to this type of picture. How to take care of this or how to diagnose this? You can do a swab test. You can just take a spirit swab and try to rub it on the skin. You can see that all this dirt will come out. So that is one of the indication of dermatitis neglectum. Okay. Next question. Patient presented with painless ulcer which bleeds on touch. What is the diagnosis? The patient presents with painless ulcer. The patient presents with painless ulcer which bleeds on touch. So what becomes the diagnosis here? Look at the ulcer morphology. My only suggestion to all of you is look at the ulcer morphology. How does it look? It look red. I can also use a word beefy red. Okay, like a beefy red appearance with granulation tissue seen. So this type of beefy red ulcers with granulation tissue tells you that you are dealing with a case of donovanosis, and the ulcer of donovanosis is painless, even indurated, and it bleeds on touch. So all together tells you that you are dealing with a case of option number 1. Now Karthik, remember LGV never presents to you with ulcer. The most important presenting symptom of LGV is the lymph node. The most important presenting feature of LGV is the lymph node. Okay? So please remember the correct answer of this question is option number 2, that is lymphogranuloma venereum. Okay, lymphogranuloma venereum. Everybody will give me a quick thumbs up if you have understood this point. Everyone give me a quick thumbs up if you understood this point. The patient presented with painless ulcer which bleeds on touch. Okay? Chalo. In which genodermatosis the following finding is seen? So here you have a CT of brain, and you can see some whitish deposition in the subependymal space. So the question is, just looking at that CT, can you think about something? You have 4 options provided. Very nice, Dr. Naga, Abhishek, Karthik, Shubhangi. Anybody else want to answer? Very nice. This is a classical case of tuberous sclerosis. And what does tuberous sclerosis also known as? The answer is bone marrow disease, and this is subependymal tubers. I hope you remember that subependymal tubers. Very specific feature, or not, I should say not very specific, but most frequent or one of the feature which is seen in a patient of tuberous sclerosis. One of the features seen in the patients of tuberous sclerosis. So please give me a quick thumbs up, all of you, if you understood this point. And where did my cursor go? Yes. Wife of a truck driver presented with the following lesions. Her husband gave history of penile lesions few months back. What could be your diagnosis? Anyone? The wife of a truck driver. Anyone can tell me the answer? Please tell me the answer of very nice. This is a classical example of condyloma lata, which is a feature of secondary syphilis. Now, syphilis has various stages: stage 1, stage 2, stage 3, or primary, secondary, or latent and tertiary. In secondary syphilis, you have varied presentation. You can have macular syphilis, you can have generalized lymphadenopathy, you can have oral mucus patches or snail track ulcers, and you can see flat topped moist lesions of the genitals which are highly infective, known as condyloma lata. Now, if you remember condyloma acuminata, which we have discussed few days back, it has multiple roughened surface, while in condyloma lata you can see flat topped or moist lesions, very classical of secondary syphilis. Coming to the next question. The patient presented with the following skin lesions, and on examination he gives a history of sore throat. Anyone can tell me what is the correct answer? Anyone can tell me what is the correct answer? Very nice. Now, if you look carefully, the lesions are mainly present on the trunk. If you look carefully, the lesions are mainly present on the trunk. With a history of sore throat, please think about guttate psoriasis, not pityriasis rosea. Sore throat means we are dealing with group A, beta hemolytic, streptococcus sore throat. Streptococcal infection. Group A, beta hemolytic streptococcal infection, that is seen in a patient with the history of sore throat. Seen in the patient with the history of sore throat. So the correct answer here becomes guttate psoriasis. Okay, clear all of you? Please give me a quick thumbs up if this question is clear. Why not pityriasis rosea? Because sore throat is very frequent with group A beta hemolytic streptococcus. Coming to the next question. Please tell me the answer. A middle-aged female presented to OPD with complaints of loss of sensation in glove and stocking pattern and the following facial feature. What is your diagnosis? What is your diagnosis? The middle-aged female presented to OPD with... So here I want all my dear students to please look at the nose. Can you see some difference in the nose? Yes, so you can see saddling of the nose. Saddling of the nose with loss of sensation in glove and stocking type of pattern. Please think about the diffuse form of leprosy, which is known as Lepromatous leprosy. Please think about the diffuse form of leprosy, that is Lepromatous leprosy. Is this clear, all my dear students? Please give me a thumbs up. Very important. So Lepromatous leprosy patients will present with the diffuse involvement, loss of eyebrows. You can also see that eyebrows are also not seen here, that there is settling of the nose and there is diffuse infiltration you can see all over the body. Next question. Tell me, what are these lesions? Primary, secondary, tertiary. What are these lesions? Anyone? Primary skin lesion, secondary skin lesion, tertiary skin lesion, and specialized skin lesion. Can you tell me what is the answer here, all of you? Please give me a thumbs up. Very nice. Please remember here the answer is, or the diagnosis is, purpura. You have palpable purpura, and palpable purpura or Purpura ecchymosis, they are the primary skin lesions, not secondary, not tertiary, not specialized. These are the primary skin lesions. So very easy question. In which condition you see the following hair changes? In which condition you see the following hair changes? Trichotillomania, alopecia areata, androgenic alopecia, or telogen effluvia. Trichotillomania, alopecia areata, androgenic alopecia, or telogen effluvia. Please tell me the correct answer for this one. Very nice. Please look at this image. The hair is somewhat like this. Tapering. As you are going deep, the hair becomes more and more taper. It is thick at the top, but as you move below, it becomes taper. And this appearance is known as exclamatory hair. And exclamatory hair is a feature of alopecia areata. Okay? Not trichotillomania. The exclamatory hair is a feature of alopecia areata, where you have T lymphocyte mediated damage to the hair. You have T lymphocyte mediated damage. T lymphocyte mediated damage. T lymphocyte mediated damage. Can you tell me the answer for this question? Can you tell me the answer for this one? Anyone? Identify the instrument. Can anyone tell me the answer? Identify the instrument. Very nice. This is the Herpes knife. I think this everybody knows because you have attended this or seen this in your surgery classes. The use of this instrument is to take a thin skin graft. This will help you take the thin skin graft, very superficial thin skin graft. So the correct answer here is option number 1, that is Herpes knife. Clear, all of you? And with this, we are done with the today's session. I request all of you to please give me a thumbs up if you like the today's class. And just get back to the last slide. So please give me a quick thumbs up if you like this class. You can also subscribe to the YouTube channel named Let's Crack NEET PG. Please do follow us on the Telegram also. You can, if you have any doubt, you can just write and get your answers. You can subscribe to Unacademy using the referral code Chesta10. Subscribe to Unacademy using the referral code Chesta10. Please don't forget to hit the bell icon to get the notification of all my classes. Please do not forget to hit the bell icon to get all the notifications of my classes. I request you to give me a thumbs up so that you get the notifications of all my classes. And you can write on the comment section if you have any doubt related to the class. So thank you all of you. Take care and